Have you been struggling with walking after you've been sitting? So you've been sitting for any period of time, even short period or a few minutes up to an hour, and then you go to stand up and move and your knees in absolute agony, then this video is for you. So today we're going to talk about why that might be happening and discuss 3 simple ways in which you can sort it out straight away. Hi, welcome back to the channel. My name is Mike, and if you're new here, we talk about all things physiotherapy related, injury prevention and overcoming injury and pain, and also aging gracefully and all things fitness too. Today we're talking about knee pain that you might have when you've stood up after being sitting for any period of time. There are 3 real reasons that this might be happening, and let's just run through them quickly. It's important to know this because it will help you manage it going forwards. The first reason why you might be having knee pain when you go to stand is because you have some osteoarthritis in your knees. So that osteoarthritis, the wearing away of the cartilage and the bone in the knee, can lead to stiffening up of the knee generally. So when you sit for prolonged periods of time, or even short periods of time, the soft tissue around the knee tends to shorten a little bit, and the joint fluid which bathes the joint gets a little bit thicker, so it tends to pool over the joint lines, and then when you go to move, your knee has to re-stretch, warm itself up again, and that can be agonizingly painful for a few steps or even up to a few minutes. The second reason that might be happening is you might have sustained a meniscus injury. So that might be because you've had a traumatic injury or even an injury, a degenerative repetitive strain injury that's developed over time, and it presents pretty much like osteoarthritis in terms of the knee shrinking when you sit for periods of time. The soft tissue contracts, the joint fluid doesn't nourish the joint as well as it could when it's warmed up. So the knee as a whole tends to stiffen. It doesn't give you any pain whilst you're sat, but when you go to move again after sitting for any period of time, that as the knee tends to expand, that pain again can be really uncomfortable. And the third reason why this might be happening, most common reason anyway, is because you might have a little bit of patellofemoral joint pain. So patellofemoral joint pain simply is the pain that you experience around the kneecap as it articulates with the femur, the big leg bone. And traditionally this is a repetitive strain injury, an overuse injury as well. And it can lead to an inflammatory process where you get some swelling underneath the kneecap and around the joint. When you sit for any period of time, again, that inflammatory soup tends to pervade the joint, stop you from moving, the joint stiffens up, you then go to move, again the knee has to warm itself up in order to stop itself from being painful. And so there's some really simple ways of sorting this out and getting on top of it, and we'll just run through that quickly now. And the first one is to make sure that you're moving your knee before you stand. That sounds so straightforward, right? So all I mean here is to bend and straighten your knee. So you go through full range, so tuck it back underneath you and then straighten out as far as you can with that knee, both sides. You do about 5 or 6 repetitions, have a little rest, and then repeat it. Okay, you can do that when you know that you're going to be needing to stand up, or because it's so easy to do and takes such a short period of time, you can do it just before you stand up to prepare your knees for what's to come. Strategy number 2, equally as simple, but it's about engaging the muscles around the knee joint, your bottom, your calves, to start promoting some circulation within the leg, but also to start getting the knee more mobile, ready for movement. And by engaging the muscles, by getting them warmed up, we're rising our internal body temperature and just preparing them for the work that's to come. So simple tips that I give my patients are, the first one is to, in sitting, just push your feet into the floor, hold for a couple of seconds, and then relax. When you do that, you'll feel the muscles in your quadriceps, the front of your thigh, start to tighten up a little bit. You might feel it in your calves, or also in your bottom. So you just push, hold for a couple of seconds, and relax. So that's the first exercise, and you might just try that one, and that might be enough for you. The second way that you can do it is to keep your toes on the floor and just lift your heels up, so you feel just your calf muscles tighten. Now, I particularly like this one because it helps your body's natural circulation just flood through your calves and your knees and your lower limbs in general. So you just come up onto your toes in sitting, hold for a second or two, but you're feeling your calf muscles just tighten up a bit, and then relax. 5 or 6 times, have a little break, do it again. The third strategy or the third exercise that I would advise that you could try is in sitting, just squeeze your bum. Okay, so in sitting, just squeeze, hold for a couple of seconds and relax. 5 or 6 reps are all that you need. The third way in which you minimize the pain when you stand is to just move regularly. Okay, so anticipate that your knees might be stiffening up if it's something that you struggle with. So just change position in your seats as best you can. So you might have initially your feet tucked underneath you, then you can have them just resting out in front of you. If you have a low stool, you can pop them on a low stool. But the best way of overcoming this is to move generally. Get up regularly and not allow your knees to stiffen up. So those are the 3 main ways that you overcome your symptoms of stiffening knees that you get from osteoarthritis, patellofemoral joint pain, or meniscal injury. But also, these are just symptom control techniques. We also need to have a look at the reason why you might be getting these issues. So you can check out my website, and on there I've got some information on how to manage osteoarthritis, how to manage meniscus pain. You can check out my YouTube channel as well. I've got a really good video here about my 8-step way of managing meniscus injuries. So we need to look at the underlying cause, solve that, and that will of course in turn help you with this particular problem. So look, if you found this useful, give it a try straight away because you'll reap the rewards immediately. This really works. It's worked for everyone that I've given this to, and it can work for you too. So yeah, if you found this useful, you found the content helpful, really appreciate it if you could like the video. Consider subscribing if you like this kind of content, and good luck, and I look forward to seeing you in the next video.